Hi, my name is Linda, and I'm currently an intern at Max Form 5 this summer. Today I'll be interviewing Dr. Morgan Kelly.
Hi, my name is Morgan. I'm a pediatric resident in the Pediatric Leaders Advancing Health Equity Program at UCSF.
Thank you. So thank you so much for your time today. We really appreciate it. And one of our goals in Max this summer is to showcase the past accomplishments of other programs through our website. And we were just hoping to hear more about your experiences at Bayview Learns and CFOX today.
Great. Do you want me to go ahead?
Yeah, please introduce yourself.
As I said, Morgan, I'm in the Pediatric Leaders Advancing Health Equity, or PLUS program, and I'm a third-year resident. So I'm in my final year of pediatric residency, and I am so inspired I think every day by the patients I meet. I get to work with kids and teens, and that is the most fulfilling work. And I think in a lot of patients, I'm reminded of experiences I had way back with Bayview Learns, almost 10 years ago now. And I think that experience is what, before I even knew it, was really pushing me toward a career in pediatrics. I knew I wanted to go into healthcare, but working with youth and learning with youth, and at that time I was really a young adult, so myself showed me how powerful youth forces can be. Are there specific questions, or do you want me to share more about how I got involved?
Yeah, you could just give us some more background about what you did specifically in CFOX or Bayview Learns.
Yeah, I was more involved with Bayview Learns certainly than CFOX. So I was involved with Bayview Learns after I had graduated high school. I moved back to San Francisco after spending 4 years on the East Coast where I completed high school, and I knew that I wanted to get closer to the community that I was from. So my family roots in San Francisco are in Bayview. My granddad grew up on Gilman Ave, and I visited him for periods of maybe an hour a day, but I think there's a lot that I still didn't know, and to this day still don't know about the community I come from, and that was something that I didn't have a clear picture of what I was going to do, but I had a sense of being involved in San Francisco and in Bayview. And I met Laura Critchfield, and she told me about her vision for a youth-led program, something that was really a curriculum that was relevant to the kids in the community where the school was located. And she shared with me an idea for a class called why did all of my aunties move to Antioch? And all of my aunts do live in Antioch, and I think that really struck a nerve with me and felt like this is what I want to learn about, this is what people maybe should be learning about. So we worked together along with some high school teachers from the San Francisco Unified School District to imagine what would a curriculum look like that was relevant for the students who were studying it, and what would that look like for students in Bayview. And came up with some health courses, and why did all my aunties move to Antioch? And then there was a lot of actually just being in the community in Bayview and then the broader Bay Area community. That was the start, just designing that curriculum. And then it really transformed into a summer program where I had a clear vision of what we would do going into this program, and that really adapted based on the needs that we heard from the kids there. A lot of it was just what was accessible in Bayview and how limited that was. I will never forget experiences of when we had a field trip to Alamany Farm, right off Alamany, and there were a group of kids who couldn't go because it wasn't safe, and getting there wasn't safe. So 3 students and I had brunch at a cafe instead, and there were certain streets that I couldn't drive down to get to that brunch, and that was just so different from the experience I had growing up in San Francisco. So I think seeing and experiencing with these kids in the same city who didn't feel safe for driving down one street next to them, really I learned a lot that summer from them, and learned about myself, it was really humbling. It's a very long answer.
Yeah. No, that was really good. Thank you. I know you mentioned how the field trip was really impactful to you, and we were wondering what other points of your experience did you feel that the work you're doing helped the most?
I think I could talk for hours about how that work helped me. And to this day, I really think I benefited so much. I learned so much about San Francisco, my community, and so much about myself, and just community work. In ways that it impacted the students, if that's what you're asking. I think some of it was really just empowering, or really amplifying the voices of students to feel heard. We had a showcase at the end of that program, and people performed, and I think it was really moving for everyone there, and really powerful for students to be able to get up on stage and share what they took away from the summer experience in their own words, in their own form, whether it was actually singing or music or art, however they chose to express themselves. It was something that they came up with entirely, and it wasn't an assignment that we handed down to them. That's one thing. I think another thing was actually sometimes leaving Bayview to be able to reflect more, appreciate the Bayview community by comparing it to places outside of the neighborhood. So going to places like Chrissy Field and just seeing how much green space there is there, and the parks and the dogs and the access to water that wasn't at a Superfund toxic waste site, I think kind of put it into perspective for a lot of the students who worked with the inequalities and just access to green space. And then it was kind of nice to go on these retreats. One day we even went to Marin and worked with farm animals. So exposing all of us to different people, places, points of view.
And then what do you think were some barriers you and your collective team had during these programs?
There are lots. The barrier that we had, and I think that a lot of community work still faces, is that we are not, sometimes we operate as siloed projects and organizations, working in our separate spaces and communities, but we're all part of a larger system, and that system is not just, and it's a very powerful system, and we came up against that. So needing to get approval from the San Francisco Unified School District to actually translate the summer curriculum into something that was year-long was really hard to do. And finding a space to have these classes and finding a space for students was hard to do, because that's not something that we really had the means as a small Bayview Learns group that we were to scale out. And I think finding an audience that would receive that and here be able to level with us was difficult, and that was frustrating, because that was one of the first times I saw that how easy it is for adults to overlook the voices of youth, despite people being very clear and explicit in their needs and wants. I think it was very much overlooked. Another barrier is just the fact that to do a job well, it takes time and it takes resources. And so we had a short, summer-long program, and that was the product of almost 8 years' worth of planning and work. And then recognizing after that change and sustainable change takes time as well, and patience. And that was more of a lesson than a barrier, but I think the barrier in that is that I had a year to get to this project, and as residents we have finite periods of time, and you're only in high school for a finite period of time, and meaningful change takes longer than that.
Yeah. How has your work with Bayview Learns and See Folks impacted your career as a pediatrician?
I alluded to one of the ways in which it did, which was really just feeling most inspired by kids and youth. I think working in healthcare, and really all work, can be very exhausting. And so I, in medical school, tried to pay attention to what I felt the most energized by and what I could see myself doing for the longest period of time and finding fulfilling. And I felt, and I still feel, the most energized by working with kids and working with teenagers who, I think especially today, challenge the status quo and are able to bring fresh perspectives to things and say, like, just because we've done it a certain way traditionally doesn't mean that that's the right way of doing things or the way we always have to do things. And I first was exposed to that in Bayview Learns, and I think that Bayview Learns was a very grounding experience for me. It really, there were things that I could not ignore being in the community, and I think that there are things sometimes in healthcare, and definitely the higher you get in education and graduate school, the more removed you are from, a lot of us are, from the communities that we have roots in. And so Bayview Learns brought me back from that. I think even in high school, going to high school across the country, I in some ways was very disconnected from the things that were happening at home. And I have that experience to reflect on. I think it helps me understand where patients are coming from when I see the address that I'm, or the pharmacy that I'm sending medications to, and I know where that is in Bayview, and I know kind of barriers to getting there, and it helps me relate to patients more, but most of all, it helps me to understand myself and where I fit in, and the immense privilege I have.
Yeah, I definitely agree with your point. Like you said, as higher education, like even as you progress, you feel more disconnected. And even as a high school student, I feel like I'm so focused on like my schoolwork, but then it really takes time to think that like it's not just me, it's like this whole community. So thank you, I really appreciate that.
Thanks, Linda.
As a medical resident who practices in where they grew up, how important is it that other residents also engage with the community?
I cannot emphasize how important it is that residents work in the community, because I think improving someone's health happens in the community. We can treat people for illnesses acutely in a clinic or in a hospital, and we can prescribe like medications for short-term illnesses, but the work that goes into helping like someone realize their full health potential is really the work that like patient and their family are doing. And unless we understand the environment that patient and their family live in, I don't think that we can best serve patients to realize their full health potential. So saying it's really important to get exercise and eat a balanced diet of fruits and vegetables is going to be a lot easier for a family who maybe lives in Marin or right next door to a huge park where they can go get exercise and to a market where they can get fresh fruit and produce and have a full kitchen to prepare that, than it's going to be for someone who is living in a shelter or is living in the Tenderloin, where there are much fewer parks and places for people to be outdoors and safely exercise, and many fewer places to find fresh vegetables or produce. And maybe these are families that don't even have a full refrigerator or stove to prepare the foods that we so, I think, easily prescribe and print in like the after visit summaries from patient appointments. Medicine is very prescriptive. There's a lot of this is what you should do, this is what's best for your health. And my wish is that medicine would be a little bit more collaborative with patients, and I think doctors can do a better job, and all healthcare professionals, of listening and meeting patients where they're at. But we are so limited meeting patients where they're at when we're confined to hospital walls, because patients are already coming to meet us in that setting. So I think really understanding where all patients spend the majority of their time, and the majority of the time that they would be focusing on their health and wellness, is necessary to providing patient-centered care.
Yeah, I just want to add on to your point too. Like, I really agree with what you said, and also I feel like for a doctor or a nurse or anyone really to do their job well in healthcare, you also have to implement ways of the government. Like, it's kind of like a team, community, collaborative effort, like you mentioned before. It's not like we can purely rely on healthcare workers to do everything. We also have to rely on how accessible financial resources are for everyone, and food, like you mentioned.
Absolutely.
In the future, what actions do you think could be done with medical residents and Max 105 to ensure that we serve the community equitably and with the most lasting impact?
Yeah, that is an excellent question. I think that, especially just reflecting on the importance of community work, residents are limited by busy schedules and a short period of residency. And a lot of residents come here from cities outside of San Francisco, or states outside of California, and won't necessarily stay here. So working with youth who've grown up in the community and who plan to stay, especially, I think, is a way of spreading and sharing the knowledge that medical residents have in the community, because that is how we collaborate to advance everyone's health. Learning from the youth, but also teaching what we know, so that those youth can go into their community where they're already trusted and already have connections and have a voice, hopefully, and can share that knowledge. And I think there's potential for that knowledge to kind of land better and be more well received when it's coming from someone that's known and trusted. And then also for youth to act as bridges to help introduce the medical residents into the communities. On the flip side, I think we as providers can invite youth into clinical settings in our healthcare space and make time in clinic for youth to share their opinions and their desires about issues that are ongoing in the community that maybe residents don't always have the time or awareness of going to figure out, to hear that either here in our auditorium or in clinics, or even in the ward setting, just kind of combining the two worlds that are often separated by the concrete walls of our hospitals and clinics.
That's actually all for this interview. Thank you so much. Yeah, even though I was not a part of Bayview Learns, I feel like I didn't get a small glimpse of what you've been through, and it sounds like you've come such a far way, especially to where we are now, where we have more access to resources.
I appreciate that, Linda. I have a long ways to go, and I am always learning, and I am so grateful for all that I learned from you and from your peers and from Max. So thank you for everything that you guys have done.
Thank you.